Endocet is a medication that helps to relieve moderate to severe pain. It contains an opioid pain reliever called oxycodone, which works in the brain to change how your body feels and responds to pain. It also contains a non-opioid pain reliever called acetaminophen, which can also reduce a fever. Before you start taking Endocet, make sure to read the medication guide provided by your pharmacist. It's important to take this medication by mouth as directed by your doctor. You can take it with or without food, but if you experience nausea, taking it with food may help. Be sure to ask your doctor or pharmacist about other ways to decrease nausea. It's important to avoid eating grapefruit or drinking grapefruit juice while using this medication, as it can increase the chance of side effects. If you are using the liquid form of this medication, be sure to use a medication measuring device to carefully measure the prescribed dose. The dosage is based on your medical condition and response to treatment, so it's important not to increase your dose or take the medication more often than prescribed. Pain medications work best if they are used as the first signs of pain occur, and if you have ongoing pain, your doctor may direct you to also take other medications. Suddenly stopping this medication may cause withdrawal, so it's important to follow your doctor's instructions for stopping the medication. It's also important to talk to your doctor if the medication stops working well, and to take this medication exactly as prescribed to lower the risk of addiction. Be sure to tell your doctor if your pain does not get better or if it gets worse. Some common side effects of Endocet may include nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness. These side effects may lessen over time, but if they persist or worsen, it's important to notify your doctor or pharmacist. To help prevent constipation, it's recommended to include dietary fiber in your diet, drink plenty of water, and exercise. In some cases, a laxative may be necessary, so be sure to ask your pharmacist for the right type for you. To reduce the risk of dizziness and lightheadedness, it's advised to get up slowly when transitioning from a sitting or lying position. It's important to remember that this medication has been prescribed to you because the benefit outweighs the risk of potential side effects. While many people may not experience serious side effects, it's crucial to contact your doctor immediately if you experience interrupted breathing during sleep, mental or mood changes, severe stomach or abdominal pain, difficulty urinating, or signs of your adrenal glands not functioning properly, such as loss of appetite, unusual tiredness, or weight loss. If you experience fainting, seizures, slow or shallow breathing, or severe drowsiness, it's important to seek medical help right away. Although rare, a serious allergic reaction to this drug may occur, so it's important to get medical help immediately if you notice any symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. When taking Endocet, it's important to be aware of the potential risks and side effects. This medication has a risk for abuse and addiction, which can lead to overdose and even death. It may also cause severe breathing problems, especially when you first start taking it or after a dose increase. It's crucial to take the smallest effective dose for the shortest possible time to lower your risk. Always follow your doctor's instructions closely. If you have concerns about opioid overdose, talk to your doctor or pharmacist about having naloxone available. Be cautious about combining Endocet with alcohol or other drugs that can cause drowsiness or breathing problems, as it may lead to serious side effects or even death. Also, be mindful of other medications that may affect how Endocet works in your body. Additionally, it's important to keep Endocet in a safe place to prevent theft, misuse, or abuse. If someone accidentally swallows this drug, seek medical help immediately. One of the ingredients in Endocet is acetaminophen, which can cause serious liver disease if taken in excessive amounts. Make sure to not exceed the recommended daily dosage of acetaminophen and avoid using it with other medications containing acetaminophen without consulting your doctor or pharmacist. Daily alcohol use, especially when combined with acetaminophen, can also pose a risk to your liver, so it's best to avoid alcohol while taking Endocet. If you are a woman of childbearing age, it's important to discuss the risks and benefits of using Endocet with your doctor. Using this medication during pregnancy may slightly increase the risk of birth defects and can also lead to withdrawal symptoms in newborn babies if used for a long time or in high doses near the expected delivery date. Always inform your doctor if you are pregnant or planning to become pregnant before using Endocet. Before taking Endocet, it's important to let your doctor or pharmacist know if you have any allergies to this medication or other opioids. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Before using Endocet, it's crucial to inform your doctor or pharmacist about your medical history, especially if you have any brain disorders, breathing problems, kidney or liver disease, mental/mood disorders, or a history of substance use disorder. It's important to talk about any other health conditions you may have, such as stomach or intestinal problems, difficulty urinating, gallbladder disease, or pancreatitis. Endocet may cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you can do so safely, and to avoid alcoholic beverages. If you are using marijuana, it's important to discuss this with your doctor. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid certain substances in your diet, it's important to use caution when using liquid Endocet products. It's crucial to talk to your doctor or pharmacist about using this product safely. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Endocet, especially confusion, dizziness, drowsiness, and slow/shallow breathing. During pregnancy, Endocet should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it's important to consult your doctor before using Endocet, as it can pass into breast milk and may have undesirable effects on a nursing infant. Remember, Endocet may interact with other medications and cause serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and share it with your doctor and pharmacist. Some products that may interact with Endocet are certain pain medications, naltrexone, and samidorphan. Also, be cautious when taking Endocet with other opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Always check the labels on your medicines for ingredients that may cause drowsiness, and ask your pharmacist about using those products safely. Additionally, other medications can affect how Endocet works in your body, so be aware of any potential interactions. Lastly, this medication may interfere with certain lab tests, so make sure your lab personnel and doctors are aware that you are taking Endocet. If someone has taken too much Endocet and is experiencing severe symptoms such as passing out or difficulty breathing, administer naloxone if available and then call 911. If the person is awake and not showing any symptoms, contact a poison control center immediately. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an Endocet overdose may include slow or shallow breathing, slow heartbeat, coma, nausea, vomiting, loss of appetite, sweating, stomach or abdominal pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Remember to always seek medical attention in case of an overdose. Sharing Endocet with others is illegal. It has been prescribed for your specific condition, so do not use it for any other condition unless your doctor tells you to. In that case, a different medication may be needed. If you are taking Endocet regularly and happen to miss a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at your regular scheduled time. Don't take a double dose to make up for the missed one. When it comes to storing Endocet, it's important to keep it at room temperature and away from light and moisture. Different brands of this medication may have different storage needs, so it's best to check the product package for specific instructions or ask your pharmacist for guidance. And as always, make sure to keep all medications out of reach of children and pets. When it comes to disposing of Endocet, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. For more details on how to safely dispose of Endocet, you can read the medication guide that comes with the medication, or consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.